health risks of smoking are well known, but many young and old people still do it. But what makes people smoke tobacco?
Calms nerves, helps you think.
They smoke because they have a lot of stress.
It helps me my nerves, calms my nerves.
What makes people smoke? What are the impacts of smoking on public health and the public health system? Is there evidence that nicotine and smoking can have some sort of developmental problems for a growing mind? And is there evidence that smoking makes one vulnerable to COVID-19? Hello and welcome. I'm your host, Dr. Musa Mtombeni. Signing with us today is Trifosa Nsolengwe. On Vital Signs today, we focus on smoking trends, addiction, and your health. Coming up on the program, we'll listen to an insert produced by Zama Buthelezi. She spoke to a mother from Soweto battling with smoking. We'll also speak to an e-cigarette store owner and a young man who, out of peer pressure, started smoking happily. They share their stories with us today. We'll then speak to a specialist scientist from the South African Medical Research Council and then speak to the deputy director from the National Council Against Smoking. Remember that you can be a part of the show by simply asking our guests the questions or the statements that you have on your mind. Simply share your views with us on what we're discussing today. The number to call is 011-714-5861. That's 011-714-5877 is the other number that you can call. And you can also share your thoughts with us on social media using Twitter. It's at SABC Vital Signs or on Facebook, SABC Vital Signs. The show continues right after this ad break.
We could all use a change of lockdown scenery this summer. Buy 4 selected Dunlop tires and get a free pair of binoculars. Plus 20% discount at Sandparks and SMV KZN Wildlife for your socially distanced summer escape. Visit our website to find a dealer near you. Dunlop, take the road.
Vito ra mina I Hlengani Patrick Mavasa ni mudyondzisi exikolweni xa Hanyanyani ni sungule ku tumbuluxa leswaku Hanyanyani ku va na mini cricket. Vanhu hinkwavo lava va ri ku voneni ka television siku leri ra 18 ta February 2018 loko ni fanele ni ka man of the match exikarhini ka Afrika-Dzonga na India va swi tiva leswaku ri SABC ya swi kota ku fikelela na le ka tindhawu tele kule laha ku nga kule swinene na laha migingiriko ya cricket yi tlanga kona. Swikolo swa Giyani swa swi tlanga mini cricket swi sukile eka 6 swi va 18 hi vito ra SABC Sport.
Good afternoon to you. We're coming to you live from Auckland Park.
Power outages have left a trail of destruction.
To do a test that requires electricity. The patient only came for that and they're going to pay for that. So it is a problem.
South Africa secured these 131 billion rands to help fund the country's just transition from coal to low carbon energy. There are also concerns. Is it enough?
Welcome back. This is Vital Signs, and I'm Dr. Musa Mtombeni. On average, people who smoke die about 10 years earlier than people who have never smoked. Most people know that smoking can cause cancer, but it is also important that it causes a number of other diseases that can damage every organ in your body, including your heart, your lungs, blood vessels, reproductive organs, your mouth, skin, eyes, and even your bones. Zama Buthelezi spoke to a mother from Soweto battling with smoking. Let's take a listen to her story.
Warnings about chemicals in tobacco smoke that increase the chance of heart problems and cardiovascular diseases have not deterred smokers. Soweto resident Pearl Dlamini, not her real name, is one of many women who smoke. But how and when did it all start?
It's 22 years now. 1999, I was pregnant. I was craving for the smells of cigarette. That's how I started smoking.
How often does Dlamini smoke?
I smoke a full packet of a 20 a day.
People spend thousands per month on cigarettes. Is it the case with Dlamini?
I would say maybe 1.8 a month.
I asked Dlamini if she's aware of the dangers of smoking.
Yes, I am. That smoking kill lungs or what? I am.
Smokers are cautioned about smoking in the presence of others as this is harmful. What are Dlamini's views on this?
Can I be brutally honest? I don't care. Because I don't smoke everywhere. I smoke in my space, in my place. That's it. And so if you're affected, if you feel good, you don't like cigarettes, you can go out. You can always go out.
Has Dlamini ever tried quitting cigarettes?
I've tried several times. It didn't work. I couldn't stop smoking.
As a smoker, is Dlamini not worried that her children might pick up this habit?
Sometimes it hits me. That's all I can say. Sometimes it does hit me. It's how I wish they mustn't smoke.
Sadly, cigarettes are available for anyone to buy and sell in South Africa as they can be found in stalls on all corners. While the health system is burdened by the disease associated to smoking, it is up to individuals to make the right choice to prevent unnecessary illnesses and deaths.
Dr. Catherine Egbe is a respected research psychologist and public health scientist in South Africa who's also specialist scientist at the South African Medical Research Council's Alcohol, Tobacco and Other Drug Research Unit. And Dr. Sharon Nyatsanza, who is a public health lawyer focusing on legal and policy advocacy in tobacco control. They talk to us about the harmful addiction that is smoking. Good morning, ladies. I hope you're well today.
Good morning, Musa. I'm well, thanks. And you?
Good. Thank you, Dr. Egbe. Let's start and talk about the issue of smoking. What makes people smoke? Let me go to you, Dr. Egbe.
Okay, so that's a very complex question because people smoke for different reasons. So some people get to start smoking because they experience peer pressure. Some people smoke because their parents smoked, so their parents normalized smoking in their space, so they naturally just picked up the habit. Then some people smoke because they are, sometimes faced with this option of looking for an easy way to get out of stress, just like why people drink alcohol. Yeah, so. And another big reason why people smoke is because of the advertising and marketing of these products by the manufacturers of these products. So they make them enticing, they make them look like what the successful people should do, and they make them feel, and then people feel that they don't belong if they are not smoking. So they make it so attractive that, and market, and do targeted marketing where they make them more accessible to young people. And I must add, Musa, that about 90% of those who smoke started smoking before they were 21. About 90%. So people start smoking at an early age, and because the industry knows that if you don't pick up smoking before you are 21, you are unlikely, very much unlikely to smoke. And so they have targeted marketing to these young people, and you find people picking up the habit and then finding it difficult to let go when they really want to.
I mean, a lot of research goes into finding the reasons why people smoke and how people got into smoking. I think a lot of it lives in experimentation. So do you think resolving or coming to a solution with respect to getting people to stopping smoking or not even starting smoking starts in changing people's behavior with respect to thinking or wanting to experiment? Dr. Egbe?
Yeah, I think it's very important that we start looking at that kind of intervention where we can, educate people, because, like I mentioned, 90% of the people who are smoking today started smoking before they were 21, and so at that stage they really don't know much about, the addictive substances, the addictive substance nicotine that they get addicted to along the way, and so they start smoking, experimenting, or just taking a puff from a friend's cigarette, or just picking the stubs from their parents' cigarettes, and then before you know it, they're addicted, and then they can't get out very easily as they thought they would. So I think that is very important for us to start looking at how to create interventions to prevent them from smoking by way of education, and of course to provide cessation support to those who want to quit, because the earlier they get out of it, the better for them. Because when you smoke the longer you smoke, the more difficult it becomes for you to quit, because you now associate the smoking with a lot of other behavioral activities that when you want to stop smoking, you have to deal with those behavioral activities as well.
Dr. Nyatanza, let's talk around the law around smoking. I mean, with any substance that is deemed to not be healthy, there are laws that exist. What is the current standing with respect to the laws around smoking in South Africa?
Well, thank you for making time for this very important conversation. So we do currently have tobacco control laws in South Africa, and we're basically relying on the 1994 Tobacco Control Act. So when this was actually put into place, South Africa did actually see a drastic drop in smoking rates. So we're talking about from 1994, there were about 32% of people were smoking, and this dropped to about 20% in 2012. So we did see, a drastic drop in smoking rates. And laws are very important because they basically, I think Dr. Egbe already, talked to this. They do well in preventing the children, the teenagers, the adolescents, the youth from starting to smoke in the first place. They denormalize the smoking as well. So the current law that we have, for example, requires health warnings, which are text, as you can see. They also, for example, require people not to smoke in non-smoking areas. So, for example, when you go into restaurants, when you smoke, you go into a closed room. But what science is actually showing, for example, with regard to that, is that it doesn't protect the restaurant workers, and it still doesn't protect the people who are sitting in the non-smoking area as well. So we are right now advocating for a stronger tobacco control policy, which will actually better protect everyone, reduce smoking rates as well.
So with respect to the policy that you're chasing and want to continue to advocate for, what are the key highlights of that policy? What are the big things that you're trying to highlight?
Thank you. So the first thing is 100% smoke-free areas. So let's say in restaurants it will be completely smoke-free. We then protect the children, we protect the non-smokers. At the same time, we denormalize the act of smoking. Secondly, we're also now requiring pictorial health warnings, and these are actually larger than the current ones. So whether you can read English, for example, or not, whichever background you come from, you actually now clearly see the harms of tobacco. So these pictorial health warnings, for example, have been proven to be more effective, more noticeable as well. We actually also take the power away from tobacco companies to advertise, and we're now basically putting at the forefront the health harms of smoking, and this has been proven to be effective worldwide. Thirdly, we also increase our controls on marketing, tobacco marketing. So, for example, on the shopping tills, tobacco will not be advertised. It doesn't mean that you cannot buy it. You can buy it, but it's not freely accessible and visible to the young. And lastly, the Tobacco Control Bill will also regulate e-cigarettes, which currently are not regulated. For the past over 10 years, they are not regulated. So these are the key things that the bill does. And it is very effective. It is beneficial for everyone because we'll see a drop in smoking rates. We'll see a drop in the health burden. We also see, a drop in children starting to smoke. So these are all benefits for the country, not only health-wise, but economically.
Yeah, I think the idea of smoking seems a bit innocuous with respect to if you're 16 and you start smoking a cigarette, you never really feel the effects. So the public health system or just public health in general don't necessarily feel the effects of smoking only up until you get much older and then you have COPD, whatever other issues you may have. So let's talk around some of the problems that live around smoking, the health issues that you may face. Dr. Egbe, what are these big ones that you've highlighted and seen in your research?
So I'm going to look at research beyond even Africa. At least we know that smoking causes nothing less than 16 types of cancers, 16 types. And I must say that the notion that smoking only affects the old or when you get older is not really entirely true, because what we see is that the individual that is just starting to smoke as a teenager still has a developing brain. The brain is still developing and getting all the the growth that is needed. But then when you introduce nicotine into the mix, it affects the development of the brain. And so, but that doesn't go into the hospital because no one goes to the hospital to check for the brain development. But that affects your output. That affects your how you function in school. That affects your activities in school and so many other things. And apart from that, the time that the individual spends smoking, which is supposed to be spent reading their books or doing something more productive, that takes away from the individual. So it doesn't just affect those who are getting older, but generally we know that apart from these cancers, smoking also affects so many other parts of the body. It causes other types of diseases like COPD, cardiovascular heart disease, and so many other diseases. And I must say that not just for the persons who are smoking, because we know that around the world, about 8 million people die annually from smoking. But among the 8 million people, there are about 1.2 million that do not smoke, but are exposed to secondhand smoke. So in South Africa, we did a study by the South African Medical Research Council and Sefako Makato Health Sciences University, and we found that about almost 50% of South Africans who do not smoke are exposed to secondhand smoke in one way or the other.
Sure.
That's our finding. This was published last year.
Sure.
And that is worrisome because now some people make the decision not to smoke, and then they get affected by the smoke from other people's cigarettes. And that is a very good reason why we are advocating for the 100% smoke-free public places, because smoke, like air, you can't really limit it. It occupies a space where it finds itself. And so if you are smoking in a restaurant, for example, and you say, oh, I'm smoking in the the designated smoking area, you can't control the smoke. The smoke filters out. And then the people who go to serve you who are not smoking are inadvertently exposed to your smoke. And then they could fall sick just because they are working. And so we feel that a better protection for everyone is that everyone is protected, and especially the kids. And just to say this last bit, sometimes when I'm driving to work, I see parents in their vehicles taking their kids to school, and the kids are at the back. Some of them are very small babies, children that in preschool, and the parents are smoking, and they're in the car. How do you protect that child? So apart from the teenagers who may not present at the hospital, you find smoking-related diseases a lot among children, among kids that are in like preschool, like before they become teenagers, and you see them presenting with asthma, with COPD, and you begin to wonder what's going on. They are exposed to secondhand smoke, and that's the cause.
Very interesting discussion that we're having this morning, talking about smoking, the effects of smoking, tobacco, cigarettes, and of course we'll speak to e-cigarettes as well as the use of hubbly bubbly and the popularity that lives within that. We'll continue our discussion with our two guests as we come back from the ad break. Stay with us.
Every life starts with a journey. Every journey starts with a dream. And every dream starts with a good night's rest.
This is the SABC News offices in Cape Town. This is where we bring your stories so that you may have a voice. Come, follow us inside.
So Mariska, the story went very well yesterday.
Good.
How are we taking it further today?
I've spoken to a few people who's agreed to be interviewed, so I think we can get going.
All right, let's get on it.
Great stuff.
Means Amanda has not felt it means like.
Hey Tandy, hey Vanessa. Hi there, Mariska.
By the way, Vanessa, how are you? We are on deadline, you know.
Tandy, I actually have my script right here. I'm ready to go and package. Let me do that right away.
Second checking, SABC News, George.
And this is where we put it all together to bring you the news. Your SABC, independent, impartial.
Welcome back. This is Vital Signs. I'm Dr. Musam Tombeni. Smokers are now buying illicit cigarettes at an unprecedented scale. Much of the illicit trade, of course, of cigarettes do not even adhere to the industry and government safety standards, and has been found in instances could contain so many foreign and abnormal particles and chemicals that pose even more dangers to your health for the smoker. Now, the illegal products are manufactured in haphazard ways with no regard for health regulations, and Dr. Sharon Nyatsanza is a public health lawyer focusing on legal as well as policy advocacy in tobacco control, and she continues to have this chat with us as we talk about illicit cigarettes and the dangers that come with it. Dr. Nyatsanza, let's talk around illegal cigarettes. What does that mean? I think over the past 2 years, especially with COVID coming in, there's been this big, loud sort of siren that's gone out around the issue and the idea of illegal cigarettes. So what do illegal cigarettes mean? What are they?
So thank you, Mosa. So illicit cigarettes are cigarettes that have not paid tax.
Okay.
That really is the main difference.
Mm-hmm.
And I think SARS in the past 2 weeks actually reported that the major problem that they're facing in the country is undeclared local production. So these are cigarettes that have not paid taxes.
Okay.
So we know from discussion that cigarettes have over 7,000 chemicals, over 70 cause cancer. Can we find a more harmful product? So what we do see is that these products are coming from, the local manufacturers, the national manufacturers, the tobacco company manufacturers, basically, but they are not paying tax. So, for example, a manufacturer can declare that this cigarette is going to Malawi or it's going to the UK, but it never leaves the country. These become ghost exports and they flood the illicit market. And indeed, illicit trade is a problem because it's cheaper. And because it's cheaper, it means, for example, the young adults or the young children actually have better access to it. But the real issue here is that they are not necessarily more dangerous or more harmful. Mm-hmm. Of course, we do see, for example, that there are prime cigarettes. I think we know this even from the legal side. There are prime cigarettes and then there are those which are cheaper. Mm-hmm. And the difference usually is that the prime have managed to, for example, mask away the harshness of tobacco. So sometimes when you smoke it, it's smoother or it tastes better or it smells better. But it still contains the same cancer-causing chemicals, the same deadly chemicals. So I think it is a myth rather, and I think it's important for this discussion to actually just clarify that illicit cigarettes are those which do not pay tax.
All right.
And we do need to deal with them, definitely.
All right, so there are illicit cigarettes, which are those that don't pay tax, but there is also the surge of cigarettes that are termed fake cigarettes. So these are cigarettes that are, I think, locally produced or produced internationally and find their way into the country, but have not gone through the normal safety standards of assuring that the cigarette, has these chemicals that we know about and nothing else added to that. Are these safe cigarettes to have?
So definitely this is a problem. So those ones, we call them usually counterfeits or white cigarettes, and these are not produced in the normal manufacturing houses. But they are still harmful. And I think, there's one study that was undertaken in Canada a few years ago, and it tried to compare those cigarettes with the ones that we know, the branded ones. And they couldn't really see much of a difference in terms of how harmful it is. We know, for example, that cigarettes, they kill 1 in every 2. And that is really, these are really the biggest preventable cause of death. So, obviously, the concern is maybe this one has one more chemical that we do not know of. But, the bottom line is that cigarettes are very harmful. That really, I think that's the point that I'm trying to emphasize here.
I mean, a recent study came out that basically highlighted how a lot of cigarettes are actually found to have the illicit trade sort of idea attached to them, where they're found to be much cheaper than the standard sort of cigarettes that have paid the taxes and things such as that. Do you think this contributes to the number of people that actually do start or end up taking up smoking because of just how cheap it is to get into smoking? I mean, every year we're told that the sin tax is going up more and more, 2 Rand, 3 Rand every year. And of course, this acts as a deterrent to stop people from smoking. But is the trade of illicit cigarettes contributing to the number of people taking up smoking?
So definitely illicit trade is a public health problem because it undermines public health. As you say, it's cheaper, so people actually have access to these cigarettes. And we actually do foresee that this actually can increase the number of people who smoke. That is why it's very important to stamp down and stop illicit trade. And we know that the solutions for this include a stronger tax administration system.
Yeah.
So for example, technologies like the track and trace, where, for example, tax authorities are able to track and see, for example, this cigarette was intended for Europe, and it didn't get there, they actually are able to actually go back to the manufacturer to actually try and obviously charge them or whatever. But these are very important systems that we need to put in place. So what we do see, definitely, you see a lot of talk in the media about illicit trade, but we need to really realize that the tobacco companies, actually their hands are not clean. They themselves are involved or sometimes are actually complicit in illicit trade. And they do benefit in magnifying the problem. Because, for example, when we say raise taxes, they will say illicit trade. When we say please pass the bill, they will say illicit trade. So they actually will benefit from that narrative as well. But it doesn't take away the fact that we need to stem down illicit trade. We need a track and trace system. We need, for example, tax stamps that actually will allow the tax authorities to track and to actually stop the problem, because it really is a problem. So, for example, South Africa signed what we call ITP, the illicit trade protocol, but it has never ratified it. And this is an important protocol because it brings solutions to the ground on how we tackle illicit trade. So the solutions, we know them, and the problems, again, are linked to the issue of enforcement, the issue of tax administration. It's not linked to control policies or linked to tax increases.
Okay, look, we continue this discussion, of course, around the idea of smoking. Is it good? Is there ever any good that comes from smoking? And, of course, all the effects. And, of course, looking at the public health perspective and how this has been affected. We continue this discussion after the ad break. Dr. Catherine Egby is also going to be joining us. She's a psychologist as well as public health scientist at South African Medical Research Council, as well as Dr. Sharon Nyatanza, a public health lawyer who also focuses on legal and policy advocacy in tobacco control. Stay with us.
There is no longer any doubt that climate change presents a critical and urgent threat to humanity. This is so because it will have devastating consequences for our economies and societies if we do not take action.
This must be done in a manner that is just, that requires a lot of attention to be paid to workers who might find their jobs at risk.
You go to renewables, you will have to combine it with nuclear, so that base load is coming from nuclear, and have a balanced approach to energy. As long as we're careful and systematic and our approach is balanced, we'll go very far.
We've got new power stations that have just been concluded for billions of dollars. How on earth do you build billions of dollars worth of coal power stations and then you go and announce in America, wherever they are, that I'm closing all those power stations because I want to have green energy?
Welcome back. This is Vital Signs. They're often pitched as off-ramp drugs. Now, these are drugs that could help smokers quit and make a better alternative for the youth. But research says something a little bit different. E-cigarettes are a new product and the long-term effects are unknown. And research, of course, needs to be done in order to establish the effects, the long and the short, of using e-cigarettes. Now, the sale and the distribution of e-cigarettes is banned in 41 countries, including 4 African countries, being Ethiopia, Gambia, Mauritius, and Uganda. Shamima Musa, an e-cigarette store owner, sat down with Zama Buthelezi to have a chat around e-cigarettes.
E-cigarettes have been touted as a means for traditional cigarette smokers to quit smoking. However, the dramatic increase in the number of adolescents and young adults using e-cigarettes or vaping is a cause for concern as long-term effects remain unknown. Store owner Shamima Musa explains to us what an e-cigarette is.
An e-cigarette essentially is a battery-operated device. E-cigarettes do not produce tar. They do not produce carbon monoxide, which is 2 of the most damaging aspects of smoking traditional tobacco cigarettes.
An e-liquid is put into the device, but how safe are these?
All e-liquids that we stock in our stores are made in a laboratory, ISO 7 laboratory. So we are conscious about, having the consumer buy something that is safe.
Who is likely to use this device?
Generally, it's adult female and male smokers that come to the e-cig store.
According to Musa, the black market has seen illicit cigarettes being sold all over the country, worsened by the ban last year. But is it the same with vaping?
The black market has had an impact on the vaping industry. What happens in my store, I can control. But out there, I cannot control, where the consumer goes and purchases their devices or their things, which is something that is of a concern. That is why we're fighting for regulations. We're fighting for regulations to go through so that consumers feel comfortable, feel safe to come to a vape store.
The government controls e-cigarettes as tobacco products. This means that you must be 18 years or older to buy them. Musa says that as the vaping industry, they are all for regulation, but they do not want to be put under the same umbrella with tobacco.
We are members of the Vapor Product Association. Okay, they represent manufacturers, wholesalers and retailers. And we are fighting for fair and just regulation, so that the vaping industry can be known under its own umbrella, not just tobacco. So we don't want to put it out there to the public to say, vaping is tobacco, and we are implying that the harms of a tobacco cigarette is the same harms as a vaping device or a vape. So that's something that is important for people to know.
What are the implications of e-cigarettes? Very interesting, right? There it is. It's a new thing. It's just come about. And a lot of people are actually finding a lot of stores in the areas that they live in malls. I mean, I've seen sections in 4 big malls. It's a big store that just sells e-cigarettes. And of course, there's a huge uptake of this because the market is there. We'll continue our discussion with Dr. Egbe, who is a respected research psychologist and public health scientist in South Africa, as well as Dr. Nyatsanza, a public health lawyer focusing on legal and policy advocacy and tobacco control. We'll continue our discussion with them. And let's jump into this idea of e-cigarettes being healthier or better than cigarettes as it is. Catherine Egbe, doctor, can you tell us, is there a real difference between the two?
Okay, so thanks, Dr. Mosa. So I think that, first of all, let's understand these two products. So we have tobacco products, and all tobacco products contain nicotine. But not all nicotine products contain tobacco. Mm-hmm. And tobacco is not the only harmful substance in the tobacco products. So tobacco, when it's burnt, releases or produces more substances or more components that are harmful. And the temperature with which you burn the tobacco for smoking is higher than the temperature with which you burn the e-liquid for vaping. Mm-hmm. So there is a temperature difference. There is the fact that one doesn't contain tobacco, one contains tobacco. But we must understand also that in terms of the risk profile, we cannot really put it's not a simple thing to do in terms of grading them, because there are so many things involved in the smoking of tobacco and vaping that would determine what risk profile a person who is smoking cigarette and another one who is smoking or is vaping would be in. So you can have two people, one smoking and the other one vaping, and both of them may actually have the same risk profile depending on how they are using these products. So I'm trying to make this, this scenario so that you can understand that it's not a clear-cut thing for you to say this product is less harmful than this other one. Because someone who is smoking, for example, 1 cigarette per day, and another person who is vaping a full e-liquid per day, the person that is smoking, that is using the e-liquid will be more, harmed by the product than the one who is smoking. So some of these tobacco-related diseases, we call them tobacco-related diseases, but some of them are also linked to nicotine use. Some of them have a linear effect, or they have like a dose-response effect. That is, the more you use the product, the more you get the disease. While there are some others that do not have that kind of dose response. So just smoking 3 sticks of cigarette, for example, can get you to that 80% risk of getting a particular disease. So if you reduce by 1, it doesn't really help you. So I'm saying this because many times we run the risk of just looking at the product at face value and say, okay, this is less harmful than the other. We know that what we know is that the amount of substances produced as a result of the burning of tobacco as cigarette and vape, the e-liquid as vape, the amount is different because the temperature is lower for e-cigarette. For tobacco, it's about 600 degrees to 900 degrees Celsius. For electronic cigarettes, it's about 300, 350 degrees Celsius. So the amount of substances will naturally be less. But that doesn't mean that if someone is smoking, using using e-cigarette for a lot more times than someone who is smoking, the person will automatically have less harm. No, it doesn't always work like that. So I think that's easy to just to put it out there.
Yeah. Okay. No, I think it's understood at this point in time. So I want to go to the law that lives behind this. What is the current regulation that lives, Dr. Sharon, with respect to the idea of e-cigarettes? Can you buy anywhere? Can you smoke anywhere? Are places friendlier to you having e-cigarettes versus you having a cigarette? What's the current status quo?
So, the current law actually regulates tobacco and products which have tobacco. And because e-cigarettes do not have tobacco, they've managed to escape regulation. So we are living in very dangerous times because, as Dr. Egbe already mentioned, there's no safe e-cigarette. They are harmful and they are addictive. And we're living in dangerous times because they are currently not regulated. You've seen it yourself. You go into a mall, they are marketed, and actually they are actually marketed at young children. The colors, already are targeting the child. Even if you go, for example, into Braamfontein, it's a youth center, you see a lot of billboards, which are very flashy, which are very colorful. And you also see even the flavors. You see apple, you see cherry. So in terms of marketing, for example, there's no regulation. In terms of sales, obviously, the e-cigarettes, for example, will claim that they're self-regulating, that they're not selling to under 18s, but there's no law currently. Even if you go, for example, into the mall, you can see someone using the e-cigarette because they're actually already escaping the no smoking laws. So there's currently no regulation at all, and that is very dangerous. And what we're basically advocating for is that there is evidence, clear evidence for regulation. There's only one certainty that regulation is very necessary, and it already has been delayed.
Dr. Sharon, I want to address the issue of it not being, or the e-cigarettes being banned in about 41 countries worldwide. Why have they banned the use of e-cigarettes, and why are we continuing to allow the use of e-cigarettes?
So definitely. So countries are banned for different reasons. So for example, a country like Australia, it has not banned it per se, but it only allows it to be sold under prescription. While other countries, for example, Uganda, I think has already banned the e-cigarette. And for them, they are basically taking on the precautionary principle. They don't want to react, just as we did many decades ago with tobacco, because they're saying the science is clear that it is harmful, it is addictive, and we see, for example, evidence showing that when children start smoking or start vaping or using e-cigarettes, they actually double the risk of continuing to smoke. So they start a long life addiction, and we already heard about the harm to the brain. The very important thing is that they're harmful and that they have nicotine and they're addictive. So that's why other countries have already said, you know what, we do not need this product in the country. So South Africa's approach is actually, would I say, a less strict approach, because South Africa's approach is basically regulate, and that way you reduce the potential health harms about the known and unknown health harms. You also prevent the child from starting to use, or the youth from starting to use e-cigarettes. At the same time, you actually also allow adult use. So you're regulating, the marketing, you're regulating where you can use them, you can regulate where you must sell them, or how they must look like. So packaging, labeling, etc. So for example, we've seen that other labels which say 0% nicotine, actually these products actually also have nicotine, so there's no labeling. People are using them no clue whatsoever to what is in the product.
Okay. Dr. Egbe, let's talk around the long-term and short-term effects that we do have with the use of e-cigarettes. I know a lot of research, of course, is ongoing, and these are relatively new products on the market. But what kind of outcomes and results have we gotten from research?
Okay. So before I talk about the harmful effects of using e-cigarettes, I just want to mention that in terms of using these products as cessation aids, what we found is that e-cigarette does not help people quit for good. We've done the study in South Africa. We've used South African studies, like data from over 18,000 South Africans. And what we found is that at short term, maybe 6 months, up to 6 months, people who use e-cigarette may have stopped smoking, but then they go back to use cigarettes. And that is more dangerous because then they become dual smokers, that they use the traditional cigarettes and then they use e-cigarettes, kind of increasing their risk profile. So in terms of what we have found about the harms of e-cigarettes, we know that apart from the normal, nicotine, the presence of nicotine, and nicotine being present at very high concentration in these e-liquids, which is very dangerous because nicotine itself is poison. We also know that the use of the device itself introduces a new level of harm, which is not even there in the traditional cigarette. For example, the coil is made of metals. And we've seen that the coil introduces chemicals like metals like iron, nickel, chromium to the e-liquid. So that increases the harm. We also know that it has ultrafine particles which gain more access into the organs of the body, and of course increases the possibility of causing harm. And then we have the propylene glycol and vegetable glycerin, which combines with nicotine to form harmful and carcinogenic substances like formaldehyde, acetaldehyde, and acrolein, which are known to cause cancer. So these are some substances that somehow you may not even find them in the traditional cigarette, but then they are there in the electronic cigarette. But I must add that there is still ongoing studies being done to look at the risk profile of electronic cigarettes. And every day we see more and more evidence showing that these products are harmful. They can cause cardiovascular diseases. They have been found to cause cancer in animal studies, at least as of now. They are known to cause changes in the DNA composition, something like a mutation, or which is kind of linked to carcinogenesis, that is cancer causing. And so these products are not as harmless, or they are not harmless. Let me not just say they are not as harmless. They are not harmless as they are propagated to be. And we know that young people, if they have that high level of nicotine in their system, it's even more harmful than if adults have them. And another problematic part of it is that sometimes the e-liquid has a declared nicotine level. When they were tested, they've not been done in South Africa, but outside. When they were tested, it was found that the nicotine level is higher than what is stated on the container. So a consumer may just say, okay, I want to buy this e-liquid because it has this level of nicotine. And then you're not knowing that you're taking in something even higher, which is more harmful to your body. So these are the problems with the product.
I mean, look, it's one of those things that continues to get research done on. And of course, as the reports and the research comes out, more and more information will be put out. But what I think we can take from it is that they're not as harmless as they've been made out to be. After the break, we continue our discussion with Dr. Catherine Egbe, who's a respected research psychologist and public health specialist in South Africa, about the harmful effects of hubbly bubbly, or otherwise known as hookah. Stay with us.
Fellow South Africans, we've set ourselves the target of vaccinating 70% of the adult population by the end of the year, if the majority of us choose to get vaccinated.
I'm vaccinated against COVID-19.
I did this for my family.
The power is in your decision.
Hookah or hubbly-bubbly smoking is a popular social activity in South Africa where young people or groups of people just find themselves, whether in university, restaurants, or wherever they may be, sitting in circles, passing around a pipe. Whilst large clouds of smoke and various flavors are inviting, hookah is actually a health hazard. Zababutele spoke to Sihlentule, a young man who, out of peer pressure, started smoking hubbly. Let's take a listen.
Think smoking hubbly is less harmful than a cigarette? Think again. Smoking hubbly, also known as hookah, is more dangerous than smoking a normal cigarette, so says experts. When smoking hookah, charcoal hits the tobacco in the head of the pipe, and then smoke is filtered and cooled through water at the base before being inhaled through a hose. Sihlentuli is one of many youngsters who smokes hubbly, also known as hookah, a popular social activity among young people.
I started smoking hubbly when I first started attending IPAT, so it was an influence from Abangani.
Is Ntuli aware of the dangers of smoking hubbly?
Truth be told, I haven't looked at the effects because it's not my regular thing. Because when you research, they say one pull it costs to 100 cigarettes. So that's when I pay me regularly. And I pay for a few minutes, then I back.
Hookah tobacco comes in variety of flavors. The fruity smell of the flavored tobacco attracts young people and misleads them into believing that hookah is a safe way to smoke tobacco. Could these dangers make Ntuli quit or think of quitting one day?
I am aware of the dangers, and they are very severe. Yeah.
So is it something that would make you want to quit one day? Would you like to quit? Have you tried quitting?
Definitely I would want to quit and it would be easy for me to quit because I don't do it regularly.
During social events, the hookah pipe is shared by smokers. An expert warns that this could be a major contributor in the transmission of diseases such as tuberculosis, viral hepatitis, and oral herpes. Also, sharing of hubbly-bubbly and cigarettes increase the spread of COVID-19.
Hubbly-bubbly, also known as hookah, is more dangerous than smoking a normal cigarette, so say experts. Now, smoking hubbly is becoming increasingly popular, and it's often smoked in groups at clubs as well as social gatherings. Although it's becoming increasingly popular, especially amongst young people, it is not without side effects. Although some people believe that it is less harmful than smoking cigarettes, the Centers for Disease Control and Prevention says that this is not true. The findings also reveal that hubbly contains about 36 times more tar and about 8 times more carbon monoxide than smoking one single cigarette. Dr. Catherine Egbe, respected research psychologist and public health specialist and scientist in South Africa, educates and answers some of the questions that we may have with regards to hubbly-bubbly smoking. Dr. Catherine?
Sir?
Yes. So let us continue our conversation and really look at this idea of hubbly-bubbly. I think there are very few places in 2021 that you can go nowadays where you're not offered this hubbly-bubbly sort of, what do they call it? I don't want to say machine, but the apparatus. It comes as big as it is. They set it beside your table, and whether you're having lunch, whether you're doing your nails, wherever you may be, you're offered the hubbly-bubbly. Is it as harmless as most people think it is?
Thanks, Dr. Musa. Hubbly is not harmless. It is as harmful as cigarettes. And like one of the persons you interviewed said, 1 hour session of hookah or hubbly is smoking about 5 packets of cigarettes.
Sure.
And if one is smoking 5 packets of cigarettes a day, that's like you're just committing suicide, actually. Though smoking is like committing suicide, I would say, but doing that at that high rate is really very risky. And many people have been known to be hospitalized if they get to that level. And I just need to mention that with the COVID-19 and so many infectious diseases around, it's even more dangerous because you're smoking your cigarette, you're smoking alone maybe, but when you're smoking hookah, you do it in a group. That's why it's very popular among friends and colleagues and school goers, because they gather and then they start sharing the pipes, and then you're doing that and you're sharing a pipe in this period of COVID, that increases your risk in many fold. And I must mention that hookah itself is not new. Habli is not a new product.
Yes.
It was there in the Eastern Mediterranean region and used in those days. But it has become popular because of marketing and rebranding and using of all these very attractive colors, because young people are usually attracted to colors. So now you see hookah with very attractive colors, and you wonder, is this a tobacco product or is it a toy? So you see people get attracted to these things because of the way they are presented to them, the way they are advertised to them, and the way they are normalized. And of course, using hookah and at the same time smoking, just like using e-cigarettes and at the same time smoking, increases your risk.
Okay, we've got a call from Cynthia. Cynthia Dumel. Cecilia, apologies. Cecilia? Cecilia, hello? Cecilia? Okay, Cecilia seems to have disappeared. To wrap things up, Dr. Catherine, I think we need to address the big one in the room around Habli smoking. I mean, I think we know that, it's also been mentioned that there are various, public health effects that come with it, with the spread of other diseases that may come from that. So is the social smoking versus smoking the Habli alone, is there a difference with that?
Okay, when it comes to the social smoking, because you're doing it with others, and the fact that you'll be sharing the hookah, the paraphernalia of hookah, the pipe and all the stuff. Of course, it reduces the risk if you are doing it in your house. But remember, to the social smoking, sometimes there's a study we did, although in another country, where we're looking at hookah presentation of hookah, stories of the use of hookah in the media, and we found that people reported that sometimes these people who sell the hookah product, they put other products, they put other drugs inside the hookah. So if you're doing the social smoking, you may not even know whether you're smoking tobacco and cocaine or tobacco and Dakar or something else. So I think that increases even the risk further. I think that at some point we need to understand that people need to be educated, because what I've found most of the time is that many of the youngsters don't think that hookah is tobacco. So that should be the stage
highlight,
of education. This is the same as tobacco. It's tobacco that is put there. You're getting the tar, you're getting the nicotine, you're getting all the combusted components of the combustion, and you're not escaping anything. And that, of course, is not a good thing to put in mind.
Thank you so much, Doctor, for joining us today and really enlightening us on the research that has come about with regards to smoking and all the big things that a lot of people have been ignoring, or those that just didn't know about smoking Habli, about smoking e-cigarettes, and of course, smoking cigarettes. I hope that today has been very informative. And if you are a smoker, made you think twice about continuing with your habit. And those that don't smoke, think twice about even starting. Thank you to all the guests for participating in our show. And thank you for watching our show, Vital Signs. We'll be back again next week. Remember to stay safe and protect each other. Stay home, social distance, wash your hands, wear your mask. I'm Dr. Musamtombeni. Take care.